Good afternoon and welcome to recent trends in COVID vaccine and mask mandates for employers. My name is Nichole Atallah, and I will move to the intro slide. I am a partner and practice chair of the Labor and Employment Group at PilieroMazza, and as you can imagine, have been fielding a lot of these questions, and I will let Sarah introduce herself.
Hi, everyone. I'm Sarah Nash. I'm a partner in the Labor and Employment practice. We've been dealing with a lot of these vaccination questions over the past few weeks, so we're excited to dive in. We only have 30 minutes with you, so I think we have plenty to talk about. So we should probably start.
Yeah, so for situational awareness, we did a webinar on vaccine policies earlier this year in the summer. And as you can imagine, just the situation is consistently evolving. There's a lot that's happened since the early summer. We thought it would be appropriate to do an update, right? What are you seeing now that's different than what we saw then? What's going on with all these client, customer, government requirements, state requirements? There's just a lot going on, and there are some key principles that we think would be helpful for you to keep in mind as your company wrestles with these questions of what to do and what not to do. We are going to save questions for the end, just so you know, so that we can get through what we want to share with you today. And if we have time for questions at the end, we will certainly take them. If we don't have time, we will follow up with you as soon as we possibly can. So let's dive in. We only have one slide. These are Sarah?
I just want to mention that this presentation is eligible for HRCI credit, and we will be giving the code at the end of the class, so make sure to stay tuned for that if you would like to get credit.
Thanks, Sarah. We just got done talking about how we needed to do that, and of course I didn't do that. So anyway, we're going to kind of cover these 4 general topics, have a general discussion about them, and then certainly welcome your questions if you have them and if we can get to them. So what are those recent trends in mandates? Well, if you think back to earlier in the summer and the spring, most employers were staying away from mandatory vaccination policies. Some of them might have done an attestation, but a lot of folks are still working from home at that point. The people on site were kind of in their groove, and employers wanted to stay away from this idea that, they were going to collect medical information and try to sift through accommodations and all of that. So they were really hesitant to implement vaccine mandates. Some did, some incentives for people to get vaccinated, I'll give you $50, time off work, things like that. What we're seeing now after the Biden administration issued its policy for federal government employees and contractors or visitors on site is a definite switch to more employers, particularly federal contractors, wrestling with, do we mandate, and many of them implementing more aggressive policies than they had planned on earlier in the summer. The Delta variant certainly has played into that, because I think there was this sense that if most people were vaccinated, most people were okay, and if you chose not to be vaccinated, kind of your problem. Now more employees are concerned that even if they're vaccinated, they're not safe or their kids aren't safe. And so what is reasonable for an employer to put in place, while at the same time, not exposing themselves to a significant degree of liability. So, I think the takeaway still is that there are risks in requiring vaccinations. You still have to work through reasonable accommodation issues. You still have to figure out, as we'll talk about in a little bit, what am I going to do if somebody refuses to get vaccinated and I have this mandatory vaccination policy? But there are also risks in not proceeding with a policy. 1, employees want to know what your policy is one way or the other. And 2, now we have all these client requirements, particularly for federal contractors, but I've also in the private sector seen a number of clients say, you can't come on site or you can't do X, Y, Z without adhering to our policy. So there are risks on both sides of the equation, and sometimes what you have to do is say, what's right for us? What's right for our company, given our culture, the nature of work that we do, how many people are really coming on site right now, when do we expect more people will be on site? How many people have to go to a client site? And to make it easy for people to digest. You can have a policy that is more restrictive than what your clients require. So sometimes I get calls and people say, Nichole, I would love to require vaccines, but the client's not requiring them. And my people work on a client site. What do I do? Well, you're still their employer, so you still get to decide what your policy is. Now, we'll talk about in a minute here this idea that the EEOC has issued kind of guidance on how to handle these vaccinations. And one of their primary tenets is that in order to inquire about someone's vaccination status, that employee has to pose a direct threat to the workforce. And COVID-19 and the Delta variant have generally been accepted as a direct threat, but the EEOC's guidance says it's not going to be the same everywhere. There might, right now it might be the same everywhere because of the high rates of infection that we have. But in 3 months from now, you might have areas where there's a direct threat posed and areas where a direct threat is not posed. So those kinds of questions can make it difficult. But for now, let's proceed on the assumption that we can establish that someone contracting COVID-19 could be a direct threat to your workforce, to the safety and health of your workforce. You also can't ignore the position that someone is operating in, right? So if somebody is working from home consistently and there's no plans for them to ever come into the office or ever communicate with clients directly face-to-face, you might not need to ask them about their vaccination status. You might not have any reason to ask them about their vaccination status. So you have to think through not just the 10,000-foot view, but what's really happening on the ground and what makes sense for your workforce in light of what's happening on the ground. In any case, we advocate for a clear policy, a clear communication so that so employees understand kind of where they're at. I also kind of get the we want everyone to be vaccinated and we're going to make lives really hard until everyone gets vaccinated because I feel strongly about vaccinations. We also get the opposite end of the spectrum, which is I don't want to do any of this. I don't want to require employees to be vaccinated. That's up to them. We can take other reasonable precautions in the workplace. Why do we have to do this? I have employees that are pushing back hard because they don't believe they should be required to be vaccinated. We certainly understand both of those positions. And sometimes what I get is this, well, what am I required? What is my risk if I don't put in some sort of policy? Well, OSHA has weighed in on this to some degree, and they've basically provided guidance. They haven't mandated any particular way that you should be handling this. But their standard is that you have to take responsible action to provide a safe and healthy workplace free from recognized hazards. And they've inferred that COVID-19 can be a recognized hazard that can, kind of affect the health and safety of your workplace. They encourage vaccinations. They want employers to have a COVID-19 response policy, but they don't mandate vaccinations. So there are other ways short of mandating vaccination or mandating disclosure of vaccine status that you can promote a healthy and safe workplace. It's probably going to involve some degree of mask wearing depending on the rate of infection in your area. It might include social distancing. It might include filters in the office space to the extent that you can control that, for your overhead folks or people that work on site. But it's, I think the hard part about this is that it's not a one size fits all, and your locality can really make a difference. I know, some localities and states have started to weigh in on this. Montana, I believe their law, Sarah, correct me if I'm wrong, is that employers cannot require it, right?
Correct. Your audio might have cut out, or maybe my
No, listening. I'm still here.
Oh, okay. That's correct. I think in Montana it's also prohibited to just even ask about the status.
Okay. So, you have to watch state and local laws. Other places, not just about work, have made it more acceptable to ask about vaccines and to make it very difficult for employees that are not vaccinated and don't have a reasonable accommodation. Sarah, did you have anything to add on that particular piece?
No, I think, as you mentioned, it isn't a one-size-fits-all question. And so, especially if employers are operating on a national scope, it may very well be that you can't impose one blanket policy across, the many states where you operate. And so it's just important to stay in touch with sort of what the Delta variant prevalence is in specific areas, what the COVID prevalence is, and what the local and state requirements are. And we're anticipating that it will be an evolving issue, especially as the FDA is expected to essentially approve the COVID vaccines in the next few weeks. We're anticipating a flurry of activity following that approval as well. So some of these issues are changing.
Yes, and for those of you who don't or haven't been following this whole idea of, well, I thought the vaccine was approved, right? Well, it's been provisionally and emergency approved, and there are different standards that apply to what you can, what, for example, the federal government can require, because it's been emergency approved and not finally approved. So we expect that some states and localities and other entities will move forward with more stringent requirements once the vaccine is, approved more permanently on a permanent basis, as opposed to provisionally approved under this emergency status, which is probably one of the reasons that we'll talk about this idea behind, the Biden kind of policy in a few minutes here, but that's one reason I think they couldn't be more aggressive with their stance on vaccines than they have been, because there's this provisional approval issue.
Mm-hmm.
Right?
So let's jump into consequences, and then I suspect that a lot of folks are waiting to talk about the Biden sort of policies that have been implemented. So I won't spend too much time on this. I think that's sort of the meatier issue. But what are some consequences of failing to get vaccinated, or of an employee failing to disclose their vaccination status? And this really will depend on not just state and local requirements, but sort of what the company has decided to pursue as a policy. So depending on whether you're going to make vaccination mandatory or optional, you might have some different responses. Let me start with the optional, because that's just a little bit easier. Generally, one of the trends that Nichole identified is we've seen folks who have been giving employees the option to vaccinate. And if they do not choose to get vaccinated, they would be given an option to engage in maybe different protective activities, such as wearing a mask, testing on a weekly basis or biweekly basis, socially distancing, maybe staying home rather than coming into the office. There are a lot of different ways to prevent the spread of COVID-19, right? And so in that sort of hybrid approach, obviously, someone failing to get vaccinated presents some more flexible alternatives. The other circumstance, however, as you know, is where a policy is mandatory. If companies are mandating the vaccine, then there may be not as many opportunities where an employee can fail to get vaccinated and still remain employed. And I'll talk more thoroughly about accommodations. I think it's our last topic, but before we get to that, where a policy mandates vaccination, a company still has an obligation to accommodate for two different types of accommodations: disability accommodations and religious accommodations. And so it's important in any mandatory policy that you still have notes about how the company accommodates for those two different needs. And you need to go through a fairly regimented process if someone says that they need an accommodation due to either a religious need or a disability need. And in those circumstances, it can get a little bit difficult, and this is sort of why I think a lot of companies have gone with the hybrid approach, because it gets messy when you're talking about accommodations. Essentially, it's the same test that you would apply with any need for an accommodation, right? You want to make sure that you are able to provide an accommodation that does not create a undue hardship for the company. And there's also this added idea of the health of the employee themselves, and that's a direct threat analysis. And so you want to evaluate whether there's a direct threat to this employee based on the fact that they're failing to get vaccinated. If you decide that this employee does not have a reasonable need for, or you cannot provide a reasonable accommodation, you can, in that circumstance, terminate the employee, but you want to make really sure that you've gone through the analysis of making sure that there's nothing that you can do short of them getting vaccinated that could allow them to continue working without being a threat to themselves or a threat to the company.
So yeah, so one example of that might be, there have been a few quasi-government agencies that have basically said, if you're a contractor and you're not vaccinated, you're not coming on site. And I don't care if you have a religious reason, I don't care if you have a medical reason, we're not your employer. We're concerned about keeping our federal workforce safe. And in those situations, you might run into a situation where you can't accommodate that person because that person has to work on that government site. And if that person can't work on that government site, you can't accommodate them. So that would be one, I think, more clear-cut example of, you know, in a case where you couldn't accommodate somebody with a religious or medical reason. But short of that religious and medical reason, it's really, you know, the short answer is yes, you can ask employees about their vaccination status, give, you know, assuming you're still keeping your finger on the pulse of this, like, is COVID still a direct threat? And is this person, you know, all those things I talked about before. If they decline to answer or they don't get vaccinated, the question is, have you thought through your clear answer to, I am not getting vaccinated and I don't have an accommodation need, I'm just not doing it? Are you going to terminate, or are you going to provide alternatives to vaccination, testing, masking, social distancing, restrictions on business travel, things like that? And if the answer is, you know, one of the two, then you really have to think through those scenarios, right? Are we going to say it's termination or reasonable accommodation? And then if there is a reasonable accommodation test, we need to work through our ADA reasonable accommodation process, right?
And Nichole, you raised something that we were actually talking about last night, which is this idea of asking employees about their vaccination status. And the question has come up, can we ask applicants about their vaccination status? And generally that is permissible, however, with one big caveat. As HR folks who are listening likely already know, you cannot ask applicants about a disability. And so when we are asking applicants about their vaccination status, that has the possibility of opening the door to questions about a disability. So if they, for example, say they're not vaccinated and then start to talk about the reasons for why they're not vaccinated, perhaps it relates to a medical disability, that can get really messy from an ADA perspective. And so what we've been recommending is maybe avoiding asking applicants about their status before they have been issued an offer. Of course, companies can still advertise that the position requires a vaccination, but that's a little bit different from asking them specific questions about their status.
Right. And, you know, you can always figure, you know, things come up in interviews, right? All the time, things come up. You might have folks that ask you about your policy. It's fine to talk about your policy. You know, this is our stance on vaccinations. That could really come up. And of course, if somebody starts delving into a disability, you know, one way to deflect that is to say, we don't really need to get into that right now, but should we make you an offer, we can discuss whether a reasonable accommodation is an option if you need it. You know, really kind of just trying to shut down further conversations that dive into disability and can get you into trouble there. Okay, let's move on to, you know, I think a question that most people are thinking about. A lot of folks are joining this webinar because of these client requirements and the Biden task force policy regarding basically any federal agency and some quasi-federal agencies. So the Safer Federal Workforce Task Force, I've got to read that because it's hard to say.
It's a mouthful. The task force.
This is really, a Biden policy that's being administered through the General Services Administration, the GSA, and the Office of Personnel Management, OPM, and it puts out essentially model safety principles. So one thing you have to understand is that each agency or quasi-government agency will put out its own policy, but they are supposed to follow these guidelines. Some agencies put out policies before this task force through OPM and GSA were able to put out their formal guidance to agencies. So you might start to see some revisions to the, I know HUD put out a memo early, and Supreme Court put out a memo early. So there are some kind of agencies that hit the ground running before this formal guidance came out, I think, last week, late last week or so. But the principles are still the same and largely follow what Biden originally announced, which is, look, you have a choice. This is not a vaccine mandate. It's what we kind of talked about earlier. You have a choice. But if you are going to have personnel on site, or it's really an access requirement, you're either going to get vaccinated or there are going to be some other requirements imposed on you. Testing at least once a week. Some agencies are requiring more frequent testing than once a week. Or masking on site, but right now, like in the DC area, everybody's masked on site anyway. There's a mandate here, so a lot of sites are going back to mandated masking for everyone anyway, and the CDC tends to recommend that indoors anyway, so they're following CDC guidance. But employees are not necessarily required, or contractors are not required to provide their vaccine card. They're supposed to submit this attestation form that says, I'm vaccinated, I'm not vaccinated, or I don't want to tell you whether I'm vaccinated or not because I, don't want you to have my medical information, which is the position some employees are taking. So it's not requiring them to do one or the other. It's just saying, look, you have a choice, but if you don't get vaccinated, you're going to have to jump through these additional hoops. The federal government has said that it will pay for the time that employees take to test. Some agencies will have testing on site, others do not have testing on site. What is becoming more apparent is that it's likely that contractors and visitors will not have access to that testing mechanism that the federal government is running. Some may, but I think it's starting to become clearer than it was before, that essentially a contractor employee is going to show up on site and have to show either have this attestation done already through their system, or is going to have to show, the results of their test within 72 hours of when they're coming on site. They've shown the test once per week, however that agency is administering it. So you should still be watching if you are a federal contractor and have not received the policy memo from your agency. It's sort of business as usual until you get that policy memo. However, you should be reasonably anticipating that it's coming. So in many cases, part of your corporate policy can be, this is our corporate policy. You should also be aware that you are going to have to follow any client site policy where you are going on site at that agency. And it's coming. So gear up for it, right? So that gives people an opportunity to choose to be vaccinated and fully vaccinated if they want to, because as you likely know by now, it's not like you walk in, you get a shot and you can go on site the next day. Fully vaccinated, depending on the type of vaccine that a person receives, means several weeks usually after the last dose of that vaccine. So, in the interim, if employees are not fully vaccinated, they are going to have to adhere to these policy guidelines that the agencies are putting out. So the feedback I'm getting, some employers are just saying, we'll comply with whatever policy is on site. And that can be okay. It's not going to cover your corporate staff or people that aren't on site at federal agencies. So you're going to have to fill that gap somehow. But you can certainly tell employees that they just have to they have to make sure that they at least follow your policy and the client site policy. And employees that say, why are you making me do this? Why are you mandating this? It's really a choice. It's not a vaccine mandate. It's really a choice. But I know that choice isn't always ideal for a lot of people. There are also the question of, okay, the government's requiring all this stuff. What do I have to pay for? Because the government's paying for its folks. What do I have to pay for? Right now, the time off to get tested is covered under the Families First Coronavirus Response Act. Did I get all those letters right? I'm not exactly sure, but FCRA. And through September 30th, if your company, is under 500 employees, you can get reimbursed for that time that it takes them to go get tested. I think the federal government policy is like no more than 1 hour of reimbursed work time to go get tested or vaccinated. The cost of the vaccine is a little bit more complicated, I think, because if you are requiring people to get vaccinated, the general school of thought and some state laws, again, this goes back to checking the state and federal law, seem to suggest that an employer should, foot that bill. But, there are, in many localities, there are free testing options. There are at-home testing options now if you are inclined to be okay with an at-home testing option. It's kind of to be determined on whether the government will accept that. I'm not sure how they will show proof of that.
I believe they've essentially left it up to the agencies to decide what kind of testing they'd like to require.
Yeah, so you're just gonna have to monitor that. I've had questions about, like, can employees just get those at-home test kits from CVS? I can tell you here, the CVS is selling out of them consistently, but I don't know if that's going to.
I think that those are more consistently false positive, so it might be unacceptable, but just bear in mind that you might be more likely to be testing positive for something that you might not actually have.
Yeah, they use a different technology than the PCR test. So I think they call them antigen tests. So they are not as reliable. So my guess is, plus, how do you show proof of test? You take a picture of it at home. I don't know if that's going to work, right? I think you're going to need some other proof of testing. Again, if the vaccine is, approved permanently, this is evolving. So your policies should also say, we reserve the right to amend this policy, and give yourself a little bit of flexibility with respect to mask mandates in offices. Those things are evolving as rates of infection change in localities. So you might want to give yourself some flexibility there.
We've received a couple questions, I believe, about accommodations from not vaccinations, but from masking. And that is sort of a tricky circumstance. If your employee, for example, gets a doctor's note that says that they can't wear a mask or that they need an alternative, you need to evaluate whether you can accommodate that need. And I think in a lot of circumstances, if your customer is requiring masks on site, barring them giving you an exception to that requirement, the likelihood is that they're not going to provide an exception for your employee not to wear a mask. Maybe they can wear a face mask or a shield. Maybe they can work remotely if that's a possibility, but otherwise, I think that's a little bit more difficult to accommodate someone who says they can't wear a mask than it is to accommodate someone who maybe will have an adverse reaction to a vaccine.
Particularly if they're also not vaccinated. So I could see a situation where they say, well, I'm vaccinated, but I can't wear a mask. And perhaps your client will say, well, they need to wear XYZ into their office, but then once they get to their office, they don't have to wear a mask. Again, you have to keep in mind that accommodations and this interactive process is not necessarily a one-size-fits-all. So you could go back to that person and say, well, in the common areas, you're going to have to wear some sort of protective face covering. And let's talk about what that is. But once you're in a more isolated space, as long as you're vaccinated, we think the risk is low. But if they're unvaccinated and unable to be masked, I think there would be grounds, should you should this person not have other working options, to say, I'm sorry, we can't accommodate that. We're gonna have to figure something out. So it's not only a risk to them, it's a risk to other folks around them. And particularly when you have people working on federal government installations, you have other employers' employees working around you, federal government workforce. But you do want, you can always pass that on to the customer and see if they'll grant it. But I do think those are more difficult. I would agree with you there.
Mm-hmm.
Is that a good time to move on to what our standards for accommodations are? It's 2:30 right now, so I think we talked about it a little bit.
I think we've pretty much gone over it. I think the takeaway from all this is, once you've evaluated what the state or local law is, wherever your employees are engaged, the next question is, are you able to decide whether this is going to be a mandate to people to get vaccinated, or is it going to be an option, in which case you impose different requirements maybe for those who are unvaccinated? Obviously, client requirements can shift the way that your company policy might respond, but at the end of the day, you cannot forget the fact that accommodations are important to include in both types of policies. So we don't want to forget those ADA accommodations that are out there and those religious accommodations that need to be provided. I will mention that religious accommodation does not stop at I'm religious and I don't want the vaccine, so I shouldn't have to have it. There is a little bit more of a process involved, including that the employee has to have a sincerely held belief. And essentially, you are required to give them that benefit of the doubt unless you have a reason to doubt it. If you have a reason to doubt it, then maybe you can ask for some documentation that supports this idea that they do have a sincerely held religious belief. And then, assuming that that is the case, then you need to evaluate whether you can accommodate, or whether that sincerely held religious belief and the fact that they are unable to get vaccinated really does impose an undue hardship. It's a little bit different from the calculus that goes into a reasonable accommodation for disabilities. It's not quite as high a standard that the employer needs to meet. And so at that point, that's where the facts of the circumstances really come into play, and you need to evaluate the type of job, the location where the employee is performing the work, how closely they're going to be interacting with other folks. And it's important to go through those motions. So if someone does raise the issue with you, don't just write it off. Make sure that you're talking with your HR folks and evaluating whether it's a reasonable accommodation that you can provide.
And if you need
I won't go
into forms, if you need any of those forms, reach out to us. If you don't have a reasonable accommodation process yet in place, that should be kind of really high on your list. And we have some resources to help you with that. I also just wanted to, there was also a question about, and I hear this all the time, and then we can kind of give just some closing thoughts, is what happens if you make me get this vaccine and I suffer injury, or I have a bad side effect, or, or who's taking care of my family? This might sound a little bit callous, but this is just the truth in where we are. This is not a requirement. This is not a mandate. Even if you tell somebody they have to get vaccinated or you'll be terminated, we live in kind of an at-will employment world where everyone has a quote unquote choice, right? You can choose not to work here anymore. Nobody ever really wants to say that, right? Like, you never want to get to a place where the employee, like, you don't have to work here. But sometimes I think it's a good thing to keep at least in the back of your mind and figure out how you want to message things. But, if this isn't going to work for you, perhaps you need to find a remote job, because I have a client that requires it, or I have other employees I need to think about. Or perhaps you decide you're not going to require it and just require the whatever you have to do to get people on site if you have those obligations. But it's really going back to what reasonable measures you need to put in place to ensure the health and safety of your workforce. You can't hedge against every possible bad thing that is going to or could happen. And the incidence of that happening with this particular vaccine are very, very low. Is it out there? Sure, it's out there. Just like when you commute to work every day, you could get in a car accident and have an unfortunate outcome. We can't plan against every eventuality, but the law right now does not suggest that an employer would be held liable for that. So you have a lot of choice and there are no definitive answers. So I'm sorry we couldn't give you a like, this is what you have to do, but it's really going back to your core principles and values and what you need to accomplish your jobs.
And Nichole, you mentioned early on that there are those OSHA requirements to provide a safe working environment. So on the flip side, there is established liability out there for failing to impose basically policies that protect the employees to the extent possible from the spread of COVID. And so you need to weigh sort of your obligations in that respect.
So we've gone over our commitment to you on time, which I was not surprised by. We thought, oh, we'll have a little chat, and then so much has happened, right? Thank you for your questions. If we have not answered them, we'll get